Welcome back. Last week we told you about our general manager, Sean Newell, who passed away after a battle with pancreatic cancer.
That's right. And now we're highlighting the importance of early detection for both men and women. And joining us is Dr. Sakib Wilayat from Carl Health Methodist Hospital. Good morning.
Good morning. Thank you for having me on the show.
Yeah, thank you for joining us. Obviously, this is a sensitive topic here at WMBD, but a very important one nonetheless. Why is it so important to detect cancer in its earliest stages?
Yeah, so I mean, that's a good question. Pancreas or any type of cancer, it's very important to detect it early on because it can drastically change the outcomes. For example, if you talk about pancreas cancer, if you can detect it in its early stages, the 5-year survival is almost 90%, as compared to when you detect it in its later stages, once it has spread, that survival really goes down to about 10 to 15%. So that's why early detection just remarkably improves outcomes, both for the patient and for us. It's easier to treat the patient if it's detected early on.
Yes, definitely.
Now, what are some of the methods used for detecting cancer? What are I'd imagine there's a host of technology you guys use and utilize to, detect the cancer early, but what are the methods you use?
Yeah, so it really depends on the type of cancer. Different cancers have different methods of detecting them. For example, for breast cancer, we use imaging tests like mammography. For prostate cancer or colon cancer, we can do lab testing with PSA or like a stool test. But for colon cancer, we also do colonoscopy, which is one of the few tests which is both a screening, and if we find a polyp or an early precancerous lesion, we can take it out at the time of the screening colonoscopy, and that's how we literally can decrease our chances of getting cancer to almost zero by getting a screening colonoscopy.
Wow. I mean, so getting both screened, well, I was going to say getting screened is extremely important, and making sure you do it in the correct timeline. So what cancers are most common in men specifically?
Yeah, so the most common cancers in men still are lung cancer, colon cancer, prostate cancer. Pancreas cancer is number 7 on the list of being the most common cancer. But because there's no specific screening guidelines, recommendations, or not a specific set of symptoms, and it's detected late, it is expected to become the second most deadliest cancer by 2030.
Wow.
Yeah, pancreas cancer.
Your gastrointestinal team, they often care for patients experiencing pancreatic cancer. What are the risk factors, would you say?
So the risk factor for pancreas cancer: smoking, alcohol use, obesity, eating processed foods, and diabetes is one of the risk factors and one of the signs as well. 1 in 4 people who who have pancreas cancer were diagnosed with diabetes within the last 3 to 4 years.
Oh, wow.
So it could be an early subtle sign as well.
Yeah.
Well, so we were talking about screenings for breast cancer and colon cancer and whatnot, but we didn't get a chance to talk about screenings for pancreatic cancer. What does that look like?
So, officially there's no screening recommendation for pancreas cancer by the USPTF because of the cost-benefit analysis, but you have to watch out for very subtle signs like, weight loss, fatigue, vague abdominal discomfort, back pain, changes in your stool color, changes in your skin color. If you're experiencing these symptoms, you should talk to your primary care physician. One of the first tests we do is like a CT scan or MRI of your abdomen. And if they find a lesion on that, then here at Carl Health, we can do an endoscopic ultrasound, which is one of the few tests where we can look right next to the pancreas and also biopsy at the same time. And that is the confirmatory test for pancreas cancer.
Wow. So how is Carl Health working to help community members detect cancer early in general, would you say?
Yeah, so we're doing a lot of events. One of the upcoming events is on October 17, where we're offering free mammograms, and then twice a year we're doing free screening programs for patients. At the same time, we have a suspicion of cancer clinic where with the local community and the local health department, we try to offer free screening tests for patients.
Good deal.
Yeah.
It's fantastic that you guys offer, these free screenings and these opportunities for people to make sure that they're getting the help they need early and on time. But I do want to thank you so much for discussing this with us and know that there are plenty of resources out there, so utilize them. But again, thank you so much for joining us this morning.
Happy to be here. Yeah, if you're experiencing these early symptoms, always talk to your primary care physician. You can go to carl.org as well, and you'll find a lot of information over there.
Absolutely. And we're going to share these details on ciproud.com. Click on the WMBD This Morning tab under News.